These are my 5 top tips to ensure a speedy recovery. Number 1, react quickly to injury. By react quickly, I mean by first of all self-treating through following what's called the PRICE protocol. PRICE stands for protection, rest, ice, compression and elevation. Next, seek treatment early, because whilst the PRICE protocol is okay, the police protocol is better. Police stands for protection, optimal loading, ice, compression and elevation. The problem with completely resting or immobilising an injured part is that the damaged tissues will, as a result, invariably heal in a shortened position, resulting in a loss of range of movement. Plus, muscles will begin to waste away very quickly and so on. A physiotherapist who has the ability to not only accurately diagnose exactly what you've injured, but also grade the severity of that injury, will be able to accelerate your recovery by optimally loading the injured part during the healing phase, i.e. through advising as to the correct degree of weight to place through the injured limb, the correct stage at which to start moving it, and to what extent, and so on. Equally, although the above advice very much relates to sporting, what we call soft tissue type injuries, it is equally relevant following a bout of acute back or neck pain. In fact, a research paper published in May 2012 in the renowned Spine Journal demonstrated that back pain patients who were referred to a physiotherapist within 2 weeks of the onset of their symptoms were 50% less likely to end up requiring surgery or steroid injections. So number 1, react quickly to injury. Number 2, don't be fooled. Don't automatically presume that if your pain goes away after a day or 2, that the injury has spontaneously resolved. Yes, the body has a phenomenal ability to heal itself, but it is equally adept at deceiving itself. You see, what tends to happen is that we automatically learn subtle ways of moving which offloads the injured part so that it no longer hurts. The problem with this is that this load is simply shifted elsewhere, and a body part which is suddenly forced to bear an additional load is far more vulnerable to injury. So what started as a sprained left ankle leads 3 months later to right knee pain, and perhaps a year later to back pain, and so on. So number 2, don't be fooled. Number 3, do your research. When you're seeking treatment, try not to simply choose a clinic based on cost or location. Try to choose it based on whether or not that clinic or that individual can get you better, plus how quickly and how permanently. If you would like more guidance on this, see my earlier YouTube video entitled What's the Difference Between a Physiotherapist, an Osteopath and a Chiropractor? Number 3, do your research. Number 4, 3 strikes and you're out. Time and time again we get patients coming to us at Physiotherapy London who have undergone insanely prolonged courses of treatment elsewhere with little or no sign of improvement. Now sadly, medicine is an inexact science, primarily because humans are a truly unique species. Every individual is different and therefore unfortunately responds differently to treatment. There are just so many variables. For this reason, no one, however many patients they've successfully treated, can absolutely state that they will definitely be able to get you 100% better. However, equally, no one should be allowing you to come back appointment after appointment, week after week, with little or no sign of recovery. If there has been no change in your symptoms within 3 appointments, go elsewhere. But the important word to stress here, though, is change. You should ideally be noticing an improvement within 2 sessions, definitely 3. However, it is also important to realise that if your symptoms unfortunately initially get worse with treatment, do not immediately go elsewhere, for 2 reasons. Number 1, because it's completely normal for symptoms to often become stirred up initially with treatment, but should then settle to a point where you feel better than you did before the treatment. And number 2, because even if those symptoms don't settle and remain worse than they were before the treatment, that response provides your physio with vital information as to what treatments or which movements your injury will respond best to. They should therefore, as a result, alter their approach and your symptoms will start to improve. The worst scenario for a physio is actually not when a patient's symptoms increase with treatment, but where their symptoms remain unchanged. If you can make someone's pain worse, you know you can at least affect it, and therefore, with the correct treatment approach, can also make it better. But there should be signs of definite change and usually improvement within 3 appointments. So number 4, 3 strikes and get out of there. And finally, that brings us to number 5, help yourself. There is only so much a physiotherapist can do in a 30-minute appointment to aid your recovery. If you want to get better quickly and get the most from those sessions, do your homework. Follow the advice given and do the exercises they prescribe. And that's it. So to recap, number 1, react quickly to injury. Treat yourself, then seek help. Number 2, don't be fooled. Be sure the injury has definitely resolved and it isn't just that you found a new way of moving that takes the stress off the injured part. Number 3, do your research. Try not to simply choose a clinic based on cost or location. Try to choose it based on whether or not that clinic or that individual can get you better, plus how quickly and how permanently. Number 4, 3 strikes and you're out. If you're not experiencing a noticeable change in your symptoms within 3 appointments, go elsewhere. Number 5, help yourself. Follow your physio's advice and do the exercises they prescribe. So thanks for listening, and I hope this video has been of help.